Hi everyone, this is Dr. Chetana. In this video, I am going to answer some of the frequently asked questions from our patients. Let's get started. Cold weather or cold exposure doesn't cause any pain by itself, but cold weather can increase the existing pain. So if that's so, the people living in the Himalayas should always have pain, but it is not so, right? If you are suffering from any musculoskeletal problems, you don't always need an X-ray, CT scan or MRI. When a patient comes to us, we take their complete history, do a physical examination and do several tests to diagnose the problem. Most of the cases get diagnosed with only physical examination and history. So to confirm the diagnosis, we might prescribe X-ray or sometimes CT scan or even MRI. X-ray and CT scan causes cancer because of the radiations we are exposed to from X-rays and CT scans. But if the patients can afford, they can go for MRI. It is a safe option. Yes, even young patients also suffer from arthritis and degeneration. But arthritis and degeneration is very common in the older age groups. But in the young age, it is caused due to any autoimmune condition, infections or any trauma or injuries, due to their bad lifestyle, wrong postures, lack of exercise, due to smoking, alcohols and other bad habits. So they are also vulnerable to get arthritis. Yes, if you have any problem in your ligaments or tendons, it can be treated conservatively, naturally with physiotherapy, exercise and other modalities without surgery. But if you have a complete tear or rupture in your ligaments or tendon, you might need surgical intervention. Yes, your musculoskeletal problems can be treated without medication, but some cases may require medications. So, we will decide that after we diagnose your problem completely. Your recovery and duration of the treatment depends on many factors. One thing is your age. Another thing is whether your problem is acute or chronic, whether it started recently or it is old. It also depends on your physical activity, and it also depends on your postural care. It also depends on your occupation, on the level of your exercise, and also it also depends on your diet. So it might take a few days to few months to years. So it also depends on how seriously you follow our protocols. So if you follow all the protocols and be regular in your therapies, you will be recovered totally and permanently very soon. Once the patient comes to us, we take his detailed history, do a thorough physical examination and test to diagnose his problem. Once the problem is diagnosed, we prepare a customized, tailor-made treatment protocol, which includes postural care, treatments, diet regimen, exercise regimen, and also home treatment programs for the patient to follow at home. So then we ask him to come for the therapy every day if the symptoms are very severe. Once the symptoms subside, we slowly taper the treatments. We'll bring it to thrice a week, then twice, once a week, 15 days, once in a month, and so on until he gets totally alright. Once he gets totally alright, also he has to follow the exercise and postural care. Our duty is to just show the way. It's up to the patient to follow it or not. If he follows it, he is beneficial. If he doesn't, then we are beneficial. So it's up to you. Yes, you will recover completely and permanently. But it also depends on your compliance. It also depends on how seriously you follow our protocol, how serious you are with the postural care, how serious you are with the diet, how serious you are with the exercises. And it also depends on the severity of your damage and the extent of your damage. So whenever you have any symptoms, whenever you experience any pain, just come to us immediately. Instead of just having a painkiller and suppressing your symptoms, the faster you come to us, sooner we can start the treatments and faster will be your recovery. No, there's absolutely no side effects with these therapies and treatments. It's absolutely safe, provided you get it done in a registered hospital from a registered healthcare practitioner or a registered consultant. Both hot and cold are very effective in pain, but you should know in which pain to apply hot and which pain to apply cold. So before you do these treatments, consult us and do it very safely. There are so many patients who come to us with massive swelling and pain after hot application. So be very careful before doing this. Once your symptoms start subsiding, we slowly taper off your treatments. If you are having your treatments every day, we slowly bring it down to thrice a week, and then twice, once a week, then 15 days, month, depending on your recovery, stages of recovery and depending on your symptoms. Once you're totally recovered, we suggest you home treatments for you to continue. Postural care and exercise you have to follow throughout your life, and you have to visit us for regular follow-ups as and when we suggest you. So bed rest is not recommended for all knee and back problems. There are specific positions to rest. It all depends on your diagnosis. So consult us before you go for a bed rest. Some patients may experience pain for 1 to 3 days after therapy and exercise. It's common. It's nothing to worry about. So because our body is not used to exercise, so there might be pain. Sometimes we might change your treatment and exercise also. So if you experience any pain, please consult us. So sometimes mild pain now and then is common. But if your symptoms aggravate a lot, if you have severe pain and if it has become worse than before, that means something is not right. That means you are not following our treatment protocols. You are not following the exercise regimen. You are not following the exercises. You are not following the postural care. So some patients have the habit of exercising when they have pain. That's totally not right. You have to follow the postural care, exercise throughout your life. Otherwise, there will be reoccurrence. If you follow all our protocols, you can be symptom-free and totally recover and totally be pain-free whole through your life. Yes, of course, you should follow postural care and exercise throughout your life. If you stop, there might be reoccurrence. You have to exercise 5 days a week. Women, when you are menstruating, you can take a break for 3 to 5 days. If some patients experience severe pain, you don't have to exercise during those days. Once the pain subsides, you should again continue with your exercises. Along with the specific exercises which we have taught for your specific problem, you have to do other strengthening exercises, stretches, and also cardio exercises also. No, you don't do the same exercise throughout. Exercise has to be modified time to time. So we call you for regular follow-up. When you come for follow-up, we assess your physical condition, flexibility, strength, and prescribe exercise accordingly. So this is one of the common questions which usually female patients ask me. I work whole day. Do I still need to exercise? Of course, you need to. Work is work. Exercise is exercise. There is no comparison between the two. When you work, there is wear and tear. There is degeneration because you don't take care of your body posture while working. Exercise helps in strengthening the bones, muscles, joints, etc. but you can work safely by taking care of your posture. So the postural care is a care taken by us when we do the regular daily activities like sitting, standing, walking, sleeping, brushing, kitchen work, taking bath, etc. So when a patient comes to us, the first thing is we teach them how to do these activities with care. That is postural care. No, you don't have to go for an X-ray, CT scan, MRI again to see if you have recovered. You should be symptom free. That's important. If you're symptom free, that means you are recovered. And also when you come to us for regular follow-ups, we do the physical examination to assess your symptoms, your present condition, and also your recovery. No, it's not safe to go for these injections. It's only symptomatic and it doesn't totally cure your problem. We all know that aging is inevitable. Likewise, arthritis and degeneration. It is also a natural aging process of our body. We need not be scared of that. It is like our hair graying and skin wrinkling. But we all have to age gracefully without any aches and pains. It's possible by following a healthy lifestyle, exercise and diet.